All right.
This is not going to take a long time, but it's a great question, and it gave me an opportunity to use the thing I didn't put in last week. My father is a 90-year-old veteran. Well, thank you for your service. With a memory disturbance. So what she's saying is this guy's got some degree of Alzheimer's or something like it. He has no medical issues, meaning, I guess, no hypertension or heart disease. He's vigorously healthy, and his memory issues are minimal. He has an ugly tumor on his scalp called Desmoplastic malignant melanoma. Now, malignant melanoma is what this is, but we've never talked about it, a desmoplastic malignant melanoma. We've talked about lots of melanomas. The oncologist has ordered a scan of the scalp, but is comfortable with watching the spot. Now, it's an ugly tumor. Generally, we talk about how you're going to go about taking care of a melanoma and removing it. And then if you have lymph nodes, we talk about giving you Jimmy Carter type drug for immunotherapy. And the oncologist is getting a scan up here, but he's also happy to watch it. We haven't heard that ever about a melanoma, have we? Nobody's ever said, Daddy's got a melanoma and they're going to watch it. So this has got to be something unusual about this melanoma. He's also comfortable with watching the spot. He has given us the choice. So that now the father has a memory disturbance, but it's minimal. The guy that's asking the question clearly has a durable medical power of attorney for his dad, but his dad, being diminished to some degree, still has the right to say, I don't want you to pound on my chest, or I do want you to pound on my chest.
Yeah, but wait a minute. I want to ask you something here, because I'm focusing in on his memory issue, because the person writing this question is going to honor their father by his memory issues are minimal, and I'm going to back that up, and I'm going to put that over here with the 90-year-old. If you're 90, odds are you're going to have some memory issues.
Yeah.
I'm impressed that they're minimal with this gentleman. So I think he's really saying,
right.
I'm going to put it this way. I think he's saying Dad's got it together.
Right.
That,
right.
He's 90 and Dad, think Dad doesn't.
Yeah, we're not going to let him borrow any money.
Right, I got that. No, I got that. I got that.
So
I agree with that.
And I remember I was a medical director of a large national hospice. This patient is clearly able to make healthcare decisions.
That's exactly right.
That's what I'm saying. Okay. Now, I don't want him borrowing money, and I want to be careful with his credit card. He probably shouldn't be driving without somebody in the car with him.
Yes.
All right. Now, he has given us the choice of surgical removal or watchful waiting. Dad wants it off my body. What is your advice? Now, this is a really great question, because there are people, as I said before, almost 100%, 95, 90% of breast cancers you can treat with lumpectomy. You might have to give them chemotherapy before to shrink the tumor down, where you can do a lumpectomy. But there are people that say, if the eye offend thee, pluck it out. I want that thing off. And so we sit down with them, and we show them what the statistics are, leaving it on, taking it off. Survival's the same. The surgeon would show them what the operation's like and the recovery's like, what the difference is between a mastectomy and a lumpectomy in terms of whether your arm goes bad or it swells up or something. So the obligation here, I think, is to educate this guy about what his tumor is and what his option is if he wants to get it off, versus leave it on and watch it and not remove it unless he has to. Because this 90-year-old man might die tomorrow afternoon of a stroke. You don't know, right? So you're not forced into doing anything. All right, put it up, first one.
What's in a name that which we call a rose by any other name?
I told you last week I was going to put a rose by any other name. All right, pull it down. So we're talking about malignant melanoma. This is not the common rose. It's an uncommon rose. Okay, so put that up. Desmoplastic melanoma, you've never heard of it, have you?
No, I don't think so.
All right, put up the next one. I'm gonna leave this up a minute.
But are we getting ready to talk about the depth?
We get. All right, so next you're going to take a look at stuff on your body. Stuff on your body, all right? When you have a birthmark, that's these little cells just sitting up here. When you have a mole, you've got a pile of little cells like that.
Right.
It's not malignant. A papilloma is one of these things that's white. You know, you got them on your chest or your places in your body. But melanoma begins to spread out, and it's this spread that makes it a malignancy where these things are just a spot on your skin.
But another thing is these are all condensed and stay.
Yeah, but that one's even deeper than the melanoma.
Depth here is not. That's not the difference.
Let's look at the next. Okay,
but this. All right.
We're getting that depth.
You want to get me away from that really quick.
I do. All right, next. So when this is going to be quick because Ray always does this. He says when you want it, when you look for A, B, C, D, E. Remember asymmetry.
Cut it out.
Blah, blah, blah. Yeah, but that's when pull that down now. That's what that nurse saw on that hockey player's neck.
Right.
She didn't know it was a melanoma, but she knew that it had asymmetry, change in color, and blah, blah, blah. Now you want to talk about depth. Put up the next one. So here you go, the depth. All right, remember, once it reaches this Clark's level 3, which is that deep, it can metastasize the lymph nodes.
Yes.
And you get that out, you got to go start on lymph nodes just like you do in breast cancer. Pull that down. Desmoplastic melanoma generally does not do that. Now, we said a rose by any other name. You got that one at the body up there? We have discussed within the last year, I remember, the malignant melanoma of the retina of the eye, remember? Because that's a pigmented, it's melanin pigment. You have melanomas that occur in many, many other locations that are not the standard skin melanoma, and the desmoplastic melanoma is less than 1 1/2% of all malignant melanomas. Pull that one down. Now this is going to get easy. We'll go through this in a minute. Now this picture is of a lightly complected Irish girl who has just this, she says this looks like a bruise. If you look at that, this is what the old people used to call liver spots. It's just a little discoloration, lightly, but it was not present when she was born, and it was not a birthmark. We know from this picture that I went back and pulled out that this began to appear when this patient was in her mid-teens, red-headed, right? Blue eyes. You can pull that down now. Spent a lot of time in the sun. That is a desmoplastic malignant melanoma. So, a girl of that age, that thing should come off because it's going to grow. It's very simple looking, isn't it? This is what you have when you want to take it off. If you look at here, they have had to excise this whole piece of skin there.
Yeah.
They have made a skin graft. This right here is a pressure dressing holding the skin graft down. This is that skin graft 10 days after the operation. Pull that down. Now, that had to be done because of the age of the patient. It's going to live another 50, 60 years, and it's going to cause you some trouble if you don't. This is a desmoplastic melanoma of the scalp. Obviously, this patient has got some age on him, and the size of that thing on the scalp is the same size as that on that patient's forehead, so this operation would remove the entire top of the head. You'd have to take a big skin graft off of the thigh and put it on there and a big old pressure dress and pull that down, and then that would require big operation, frequent visits, big hole in your leg where you took the skin graft off. And these things grow so slowly, things probably been there 40 years, that a 90-year-old man very likely will never have to have it removed. Now, what did say the oncologist had done? he'd ordered a scan. I promise you, what he ordered was an MRI of the scalp to look to see if this thing was close to penetrating the skin and getting to where it would go down to the bone and the lining of the bone, which might cause him discomfort and would push him toward the removing it side. And then I'm confident that he has no fear. He's pretty sure it's not that way because the scalp is probably movable, and therefore watching it is okay. So how do you convince your dad, who wants it off his body, to let him watch it for a while? First of all, you show him some operative pictures like that and tell him how many visits he's going to have, and he's going to have this thing on his leg. And then you show him the fact that this is a very rare form of melanoma. It's not melanoma like he's thinking, and that the survival rate's virtually 100%, and that if it happens to recur, it responds really good to the Jimmy Carter medicine. So that's what I would tell your dad. Believe the oncologist. Learn from the surgeon what your option would be if you had the surgery, and you should be fairly comfortable with watching it for a while.
I understand the question. You didn't ask for my advice, and I would never do that. They asked for your advice.
What was your advice?
Well, here's the thing: is I'm picking up the question. The dad means a lot to the guy. I mean, this is hero status.
Right.
All right. I'm reading the question.
Yes.
This is my dad. He's 90. He's a veteran. He's red, white, and blue.
Yep.
I mean, so there's so much respect here. This is dad. Okay. Can't find his house slippers, but that doesn't mean he doesn't know where he's at.
That's right. Exactly.
Okay. Period. No, seriously. I mean,
Yeah.
so he's saying, look, dad knows what he wants.
He does.
Now, the one thing, and I know we got to get out, but the one thing is when we get here, he changes dad wants it off my body. He capitalizes that. So that's loud.
Yeah.
When you capitalize, that's loud.
Dad's loud about
So when
that.
he's going over and seeing dad, and he's telling dad everything the doctor said.
We don't
Dad's
know.
very
We don't
firm.
know that Dad yet has sat down with the doctor
Right.
and learned about the surgery. But if he shows him those pictures and explains to him about the skin graft and shows him what the leg's going to look like, and the guy says, "I'm willing to do it," then I'd take it off.
Let me not try to say what I don't know about these people, and let me do it personally
Yeah, that's what I want you
myself,
to-
okay? Because
Yeah.
when my dad was alive,
Yeah.
son, I don't care. When we get done, this is what we're going to do. Okay, Dad, I've explained it 3 times. Well, I'm just telling you. So I don't know if that's dad.
Well, that-
'Cause
and
my
that's fine.
dad, great guy and
And-
everything, and he had it, he had it
But
together.
he could be explained.
Oh, hell, I don't know. Someday we need to move on. We need to. No.
I'm gonna make
I'm going to personalize it with my dad, and I'm not being negative. When you said he could be explained, I tell
Maybe.
you what, I'll give him my sister's phone number. Hey, you call her and say, "Could Dad be explained?" So thank you for the question, and I know we appreciate it here, and we hope that Dr. Whaley has helped. And I think with showing your dad this segment may be of help too.
Yeah, that's good. Show him this
and
segment.
that's why you send
and get
the
the
questions.
surgeon. All right, so now I want to.
We got to get you to work.
We got to get me to work. All right.